Hi, welcome to the shoulder. The shoulder can perform many actions. Adduction or adduction, bringing the arm towards the body. Abduction or abduction, bringing the arm away from the body. Flexion, bringing the arm towards the face. Extension, bringing the arm towards the back. Medial rotation, rotating the arm towards the body. Lateral rotation, rotating the arm away from the body. And circumduction, rotating the arm in a circle.
There are three bones that make up the shoulder complex: the clavicle, the scapula, and the humerus. The clavicle, also known more commonly as the collarbone, is a superficial bone that runs horizontal to the vertical axis. The clavicle acts as a lever system. It has a strong synovial joint connection, allowing it to move up and down like a lever. The clavicle provides strong structural support between the shoulder and the rest of the skeleton. The next bone is the scapula. The scapula is a triangular-shaped bone located on the posterior portion of the body that helps to facilitate arm movements. The scapula also plays a role in the stabilization of the arm alongside the clavicle. The scapula has several fossae, ridges, and corners that serve to function as attachment sites for 17 different muscles. The final bone is the humerus. The humerus is the major long bone of the arm. The proximal end of the humerus articulates with the glenoid fossa of the scapula to form the glenohumeral joint, or the shoulder joint, which is explained in more depth later on. The humerus serves as an attachment site to 13 different muscles, which all contribute to the movements at the hand and at the elbow.
Let's talk about the joints of the shoulder. There are four main joints that make up the shoulder complex. The first highlighted joint is the sternoclavicular joint in pink. This joint is labeled a synovial saddle-shaped joint. This joint allows for the primary connection between the axial skeleton and the upper limb. This joint is also known as the SC joint. The next joint highlighted in blue is the acromioclavicular joint, or the AC joint. This is formed by the junction of the lateral clavicle and acromion process of the scapula. This is also known as a plane-style synovial joint. The next joint that needs to be discussed is the scapulothoracic joint, seen highlighted in orange. This is not a true anatomical joint. Instead, it is a unit that gathers the SC and AC joints. The last and most pertinent joint in the shoulder is the glenohumeral, seen in yellow. This is the joint most people consider when discussing the shoulder. It is formed from a combination of the humeral head and the glenoid fossa of the scapula. The glenohumeral joint is a true synovial ball and socket diarthrodial joint. The glenohumeral joint is the most common joint in the body to be dislocated. This is due to the fact that it is the most movable joint within the entirety of the body. Therefore, the shoulder complex is made up of the sternoclavicular joint, the acromioclavicular joint, the scapulothoracic joint, and the glenohumeral joint.
The shoulder has three main muscle and muscle groups: the scapulohumeral group, the thoracohumeral group, and the pectoralis major muscle. The scapulohumeral group is a group of muscles attaching the scapula and the humerus, including the rotator cuff muscle group, which we'll chat about more later, the teres major, nicknamed Lat's little helper, and the deltoid, which has three heads. The thoracohumeral group contains the serratus anterior, nicknamed the boxer's muscle, as it's the muscle involved in punching, and the subclavius muscle, which protects the subclavian artery in case of a clavicle fracture. The pectoralis major muscle is its own antagonist, and its fibers in various directions allow for various movements and protection of the glenohumeral joint.
The glenohumeral joint consists of intrinsic ligaments and an extrinsic ligament. First, let's start with the intrinsic ligaments. The first one to discuss is the coracohumeral ligament. As its name suggests, this ligament extends from the coracoid process of the scapula to the greater tubercle of the humerus. The main function of this ligament is to strengthen the superior aspect of the articular capsule. Next, let's talk about the transverse humeral ligament. This ligament extends between the lesser and greater tubercles of the humerus to the superior epiphyseal line. This ligament helps to convert the intertubercular groove into a canal. This assists in holding the tendon and synovial sheath of the long head of the biceps brachii muscle in place. Finally, let's talk about the glenohumeral ligaments. These ligaments can be further subdivided based on their location within the joint. There is a superior, middle, and inferior glenohumeral ligament. Together, These ligaments combine to form the glenohumeral joint capsule that extends from the glenoid cavity to the lesser tubercle and anatomical neck of the humerus. This helps to strengthen the anterior aspect of the articular capsule. Now, let's talk about the extrinsic ligament. This ligament is the coracoacromial ligament. This ligament extends from the acromion to the coracoid process. This is done to prevent the superior displacement of the head of the humerus from the glenoid cavity.
Next, we're going to talk about the rotator cuff muscles. You can remember these four muscles by using the acronym SITS. The first muscle is the supraspinatus, and it is a posterior muscle, and this sits superior to the scapular spine. The next muscle is the infraspinatus, and it is also a posterior muscle. It is inferior to the scapular spine and posterior to the teres minor. Next is the teres minor muscle, which is also posterior, and it is inferior to the scapular spine and anterior to the infraspinatus. Finally is the subscapularis. This is an anterior muscle and it is inferior to the clavicle. Here we're going to talk about the different bursae of the shoulder. Bursa is a fluid-filled sac or sac-like cavity, especially one countering friction at a joint. The first one is the subacromial bursa, and it is posterior to the acromion process and superior to the greater tubercle of the humerus. The second one is the subscapular bursa, and this is between the subscapularis muscle and the chest wall. And third is the subcoracoid bursa, and it is anterior to the subscapular muscle and inferior to the coracoid process.
Let's talk about nerves. Nerve is a bundle of fibers that transmits impulses to the brain or spinal cord from the muscles or organs within the body. The first nerve is a bundle of nerves called the brachial plexus, shown in yellow. It is located in the shoulder and is a large network of nerves flowing down the arm. Next is the musculocutaneous nerve, shown in purple, and it is the nerve running down the front of the arm and the lateral side of the forearm. In orange is the median nerve. This is the main nerve in the front of the forearm. Next nerve in green is the radial nerve. This nerve is responsible for the posterior portion of the upper limb. In yellow is the ulnar nerve. This is the main nerve in your arm. It is also the nerve responsible for the tingling sensation you feel when you hit your funny bone. And lastly, the subscapular nerve, seen in yellow. This is a branch off of the posterior cord of the brachial plexus. Before we start, let's remember that veins take deoxygenated blood to the heart and arteries take oxygenated blood away from the heart to the body. The first artery shown is the subclavian artery, seen in orange. This artery is where blood first enters the shoulder region and is located under the collarbone. The next artery is the axillary artery, shown in purple, which is a large blood vessel that brings blood to the lateral aspect of the thorax, the axilla or armpit, and the upper limb, and is branched off from the subclavian artery. The next artery is the thoracoacromial artery, which is branched from the axillary artery as well, and is located at the top of the shoulder and divides into 4 branches down the arm. The last artery is the brachial artery, shown in black. This artery is a continuation of the axillary artery as well, and is a main supplier of oxygenated blood for the bones and muscles of the shoulder. Now for the veins. First off is the axillary vein, which is a major vein in the upper limbs, and is formed by the paired brachial and basilic veins. Next, we have the subclavian vein, which is a continuation of the axillary vein and is located under your arm. Next is the cephalic vein, which is a major superficial vein and is the second most common vein to draw blood from in your arm. And lastly, the subscapular vein, which is a large paired deep vein that extends down each side of your neck.